Okay, so thank you everyone. Good afternoon, good morning, and good evening to all of you joining us from different parts of the world. On behalf of the IANPHI Africa Network and the Pandemic Preparedness Response and Recovery Committee, I warmly welcome you to today's webinar on the role of laboratory leadership programs in improving early detection and rapid response to outbreaks. My name is Dr. Chinwe Lucia Ochu. I'm the Vice Chair of the IANPHI Committee for Pandemic Preparedness, Response and Recovery, and also a Director at the Department of Planning, Research and Statistics of the Nigeria Center for Disease Control and Prevention. I'll be co-moderating this webinar with Alex once he joins, but this is an important webinar. Leadership programs have been deployed by public health laboratories in some countries in Africa as part of their capacity building efforts to improve epidemic and pandemic preparedness and early detection of dangerous pathogens. So we'll be listening to experts from countries share their experiences with this program and what impact it has had in their laboratory preparedness and readiness. Before we begin, a few housekeeping notes. The session is being recorded, and both the recording and slides will be shared afterwards once we have the consent of the speakers to do that. Please use the Q&A box. We don't have a Q&A box, but you can type your questions into the chat if you have questions for any of the speakers. And remember to indicate which speaker you're directing your question to, because after the presentations, we'll now go into the Q&A session where the speakers will address your questions. Feel free to engage in the chat with other comments that are not questions, your own thoughts on what is being presented. And kindly note that some of our speakers may be presented in French. And if that happens, we have captions that would provide real-time translations as they speak. We will now be introducing the first speaker, who has graciously accepted to present and share the experience of Uganda, Mr. Samuel Gidudu. He is the program coordinator for the Laboratory Leadership Program at the Ugandan National Institute of Public Health. He has previously worked as the laboratory pillar lead for a regional public health emergency operations center, district laboratory focal person, and laboratory manager. Samuel Gidudu holds a Master of Biomedical Laboratory Sciences and Management, Bachelor of Medical Laboratory Sciences, Postgraduate Diploma in Medical Education, Advanced Diploma in Health Service Management, and a true service training in field epidemiology. He's passionate about strengthening the national laboratory system to support patient care management and public health actions. Samuel has extensive experience in laboratory systems strengthening and outbreak response. He will share with us Uganda's experience with the Public Health Fellowship Program, Laboratory Leadership Program in improving early detection and rapid response. So Samuel, you're welcome. Over to you.
Thank you very much for the introduction and the invitation. I'm starting right away. So good day, everyone. Samuel Gidudu is my name. I coordinate the Laboratory Leadership Program, and today I present to you the role of Uganda's Laboratory Leadership Program in improving early detection and rapid response to outbreaks. To start with, early detection and rapid response to outbreaks in Uganda matters because the country is vulnerable to infectious disease outbreaks. These outbreaks come along with undesired impacts such as mortality and economic disruption. This therefore necessitates the need for a robust laboratory system with ability to facilitate rapid detection and effective response mechanisms. The laboratory leadership program in Uganda is a 2-year in-service competency training. The program conducts didactic sessions, mentorship sessions, project development and implementation, and community of practice implementation. We are developing a competent workforce for laboratory leaders able to build and sustain the national laboratory system to effectively and efficiently respond to human, animal, and environment health challenges in the country. LLP plays a critical role in strengthening Uganda's public health system by enhancing laboratory capacity, leadership, and coordination. The following key activities illustrate how the program contributes to early detection and rapid response. Conducting timely evaluation of laboratory readiness during emergency outbreaks. This identifies areas of improvement ahead of time, such as stock levels, personnel to inform immediate actions. Designing and executing targeted projects to address identified areas of improvement in laboratory systems. This enhances diagnostic accuracy by safety and data management. Facilitating collaboration between laboratory specialists, epidemiologists, and other health professionals during outbreak investigations. This enhances timely sample collection, testing, and reporting to inform public health decisions. Participating in regular coordination meetings among laboratory stakeholders to review progress, share updates, and align strategies. This strengthens a multi-sectoral collaboration and accountability. Empowering laboratory leaders with strategic and operational skills to drive systems improvement. Building a skilled and motivated laboratory workforce capable of responding to public health emergencies. Participating in creating standardized competency-based training resources tailored to Uganda's public health needs. This builds capacity among laboratory professionals for outbreak preparedness and response. Participating in providing real-time updates on laboratory activities during outbreaks. This in itself is enhancing transparency and informing national response strategies. Documenting and sharing lessons learned from the field deployments and outbreak responses. This is promoting evidence-based practices and continuous improvement. Offering on-site mentorship and supervision to laboratory teams. This is ensuring adherence to protocols, improvement in quality of testing, and building confidence in laboratory operations. Organizing review forums to assess laboratory performance and outbreak responses at different administrative levels or subnational levels. This is encouraging data-driven decision-making and policy refinement. The other one is strengthening collaboration between clinician and laboratory professionals. This is improving sample referral system, result interpretation, and patient management during outbreaks. The other is supporting integration of laboratory priorities into national health policies and emergency response frameworks, and establishing systems for tracking laboratory performance and outbreak response effectiveness. Uganda's laboratory leadership program is making a significant impact on early outbreak detection and rapid response in outbreaks by transforming laboratory systems and empowering laboratory professionals with leadership, technical, and strategic skills. I acknowledge the following organizations for supporting the laboratory leadership program in Uganda. Thank you very much, Secretariat.
Thank you so much, Samuel, for this very detailed presentation of Uganda's experience with the laboratory leadership program. We will now invite our next speaker, Professor Burima Kuriba.
He's not connected in a way.
Yeah,
Yeah, he's
so
not
we will
connected.
move on to once he comes in, we'll invite him to speak. But now we will listen to we'll listen to the next speaker, Professor Guindo, who is going to reflect on the leadership and coordination of the laboratory network in epidemic management in Mali. Professor Guindo is a public health pharmacist, a microbiologist who currently serves as the Director General of the National Public Health Institute in Bamako, Mali. He is the national focal point for antimicrobial resistance in Mali. His research focuses on public health microbiology and molecular biology applied to reference diagnostics. He is involved in the implementation of the global health security agenda in Mali and in strengthening laboratory capacities. He is also an associate professor in bacteriology, virology, and teach microbiology at the Faculty of Pharmacy of the USTTB. Professor Guindo, thank you for coming to share your experience. Please, the floor is yours.
Thank you very much. And thank you also for this opportunity to share our experience regarding global leadership and laboratory aspect. Okay. My presentation will be focused on leadership and coordination of the laboratory network in epidemic management in Mali. It will be very important if Professor Kuriba present first the Global Leadership Laboratory Program, but we can switch, it is not a problem. He will present after me if he arrive to join the meeting. This presentation will be held according to the outline, the following outline. After introduction, we'll talk about the context of Mali, role of laboratory network, leadership and coordination, and before conclusion, some point of recommendation and future outlooks. We can maintain that several outbreaks occur in the past in Africa. And Ebola virus, Crimea Congo virus, COVID-19, the pandemic, and from some part of the global world, we have dengue, chikungunya, and now mpox virus, and also cholera bacteria for some part in Africa, East, Central, and also West Africa. And the laboratory play an important role for the early detection of each pathogen to confirm and for more preparation of the response. Effective leadership and coordination of the laboratory network are essential for timeline and accurate disease detection, which directly impact the successful of epidemic management. The country presentation is the country is very vast, more than 1 million kilometers square, and it is a very challenge. We have 7 neighboring countries and 20 administrative regions. But in terms of health facilities, we have 65 functional health districts and more than 1,000 community health centers. And we are working together for the epidemiological surveillance across the country. And this context is particular because the country is large and the population is very dispersed that affects the public health response. Also, we have the climate change that can affect the occur of some diseases. And these diseases in Africa, Ebola in Mali, we know before some key case during Ebola outbreak, epidemic in Africa, some case of Ebola. We know also in the past cholera. Now we have some case of measles, yellow fever, and more case of dengue also. And the limited capacity in terms of infrastructure, quality management system, biosafety have to be improved for a better response. And the leadership and laboratory play an important role for that. First, the role of the laboratory network. The network have a structure. We have national reference lab, regional hospital laboratories, and also national hospital laboratories and district laboratory. It is a structure of 4 components of laboratory. And we have outside of the country, the WHO collaborating center. We work closely together for the confirmation of some pathogen epidemic-prone diseases case. In oversight, we have the regional direction in the country, national health direction also, and partner as WHO, CDC Africa, and other partner across the country that support the implementation of this laboratory system, the first competency of global leadership program. And we can show in this slide the structure of laboratory. At the bottom, we have the laboratory of district, followed by the regional laboratory of hospital and the national hospital laboratory. And at the top, we have the national public health laboratory, that is the reference laboratory in the country, working closely with the other laboratory and the research center in the country, Centre d'Infectiologie Charles Mérier, led by Professor Puriba. I think we'll follow him for his presentation. And the University Clinical Research Center also at the faculty and other laboratory, also veterinary laboratory. We worked together and we built a network laboratory in the country. And regarding the network, this is just an example for the sample transportation and feedback for the result. We can show at the top the community health laboratory and the district laboratory. And the district laboratory and community health laboratory, they can detect in terms of epidemiological surveillance some case, and their role is to take sample and to send to the laboratory that have more capacity in the country. It can be regional hospital or also a national hospital laboratory or public health reference and his collaborator. And when we receive some samples, we have to test to confirm, and the feedback process will be ongoing. And we can show at the left, the right side, the inverse process for the feedback. And we work closely together with other partner, the IDSL unit at the general office of health and other partner. And we cannot see so in this slide the place of WHO, because in case of epidemic-prone diseases pathogen detected, we have through the national AHR focal point to inform WHO and to start the process of activation of EOC, and also put in place management system for the response. The laboratory play a main role. The main role are core function. The core function are sample transportation, surveillance and early detection, diagnostics and confirmation case, tracking the spread of diseases, research and genomic sequencing, and also continuous risk assessment, involved close with the surveillance team. And we can show this core function, and also according to the picture at the bottom, you can show the enabling function, governance, workforce, communication, and also research. And all of these functions are closely involved to the laboratory leadership. And the leadership and coordination, we can focus on the outbreak recently occurred regarding Congo hemorrhagic fever, and also the pandemic of COVID-19. For leadership action we held, it is the lab network. The lab network is a group on the response structures, because the response is structured according to the incident management system, and the lab is a component of this system. And the structural organization is coordination, EOC, surveillance, contact tracing, logistic, care, communication, and also finance group. And lab is also a own group, part of the structured organization. The key decision we made during the Congo outbreak and the continuous pandemic of COVID-19 was according to the following question: who is the lead? Naturally, the National Reference Laboratory, in collaboration with other research and public health laboratory in the country. And the periodic meeting, where can we hold the periodic meeting? In case of COVID-19 pandemic, we held our periodic meeting at the Centre d'Infectiologie Charles Mérieux, led by Professor Kuriba. And we make also some decision regarding sample transportation, centralization or zoning. What decision do we have to make? And at the beginning of the pandemic of COVID-19, we start with a centralization process for sample. And according with the time, we adopt a zoning system involving all of the laboratories that have capacity to test and to provide a result within 24 hours. And over decision we make, what kind of equipment we have to buy, we have to get in the counter, the consumable, the reagent, and that help us to work together and to provide the same kind of result. And leadership, the coordination mechanisms we put in place are weekly meeting, daily discussion on WhatsApp, logistic for sample transportation and supply chain, standardization on protocol for tests and reporting, and also the report sharing for the daily release regarding the general population. And we get some success and challenges. What are the successful we observe? The lab networking was a very successful. All of the laboratory worked together during the outbreak of Congo and also COVID-19. Again, we reduce diagnosis time, turnaround time to provide the result, and also the following of the variant we detect during COVID-19 pandemic. And we observe also some challenges: funding gap, communication breakdown, sometimes security issue to transport sample, reagent standardization, lab certification, and also equipment certification. And From all of this experience, we have some recommendation and future outlook. In terms of recommendation, how to investing in infrastructure and equipment to improve the lab context to be more able to fit for emergency response, and continuous training for lab personnel, strengthening also partnership with international organizations. In terms of future outlook, the time is running, improve role of laboratories and coordination leadership, what lesson we learn from experience and build more resilient public health system in Mali. In conclusion, no laboratory can evolve alone. Laboratory network guide the system for decision-making and the crucial and essential role in being further supporting to improve early detection and characterization for a more resilient system. Thank you for your attention.
Thank you very much, Professor Guindo, for this very insightful presentation that has highlighted a lot of key factors on laboratory leadership and how that has supported Mali in their response to disease outbreaks. So let me remind participants to please make use of the chat box to send questions to any of the speakers that you want addressed, or if you have general comments, please feel free to use the chat box. So we have with us Professor Koriba, who will be our next speaker. Professor Burima Koriba is a professor of immunology at the University of Sciences, Techniques and Technologies of Bamako, Mali, and the executive director of the Center de Infectology, Charles Mirieu, Mali. Forgive my pronunciation if I didn't get that correctly. He is a member of the National Academy of Sciences of Mali and directs the master's program in medical biology at USTTB. Dr. Koriba has led several NIH-funded research projects and serves on the Ministry of Health's Task Force for Emerging Pathogen Surveillance. He earned his PharmD in 1993 in Bamako and his PhD in immunology in 2004 at the University of Marseille, and is also trained in emerging viral disease detection at the Pasteur Institute in Paris. Since 2020, Dr. Koriba has headed the Center de Infectologie Charles Mirieu, Mali, building partnerships with institutions in Africa, Europe, and China. In 2022, he coordinated the first WHO-sponsored Global Laboratory Leadership Program in Central Africa. I'm pleased to invite Professor Burima Koriba to discuss the implementation of the Global Laboratory Leadership Program at CICM Mali. Professor Koriba, the floor is yours.
Okay, thank you very much. Should you share my slide or should I share it?
Yes, you can try to share your screen.
Okay. You know, I had some problem with my computer and I have changed a computer.
Sarah, perhaps you could share for him if you have his slides.
Yes.
Yes, I can do it if you prefer.
Yes, please share it. Please.
Just tell me when I need to move.
Yes. Okay. Thank you very much for giving me the floor to share my talk about the implementation of the Global Laboratory Leadership Program, the experience of Center of Infectiology Charles Mirieu in Mali. Next. Yes, the Center of Infectiology Charles Mérieux is established since 2005 in partnership with the government of Mali and the financial support of Fondation Mérieux. And it's a public and private partnership center. The aim is to fight against infectious disease in Mali, and it consists of a laboratory, a diagnostic laboratory named Rodolphe Mérieux Laboratory, which is accredited ISO 15189. And we also have a training unit equipped with several classroom and laboratories. Next. And the Center of Infectiology organized 2 training on the Global Laboratory Leadership Program. And the first was with the sponsorship of WHO for the Central African leaders in the sector of human and animal health and environment. And the second one was organized in collaboration with Fondation Mérieux based in Lyon. And that was for Malian leader in human and animal health sector. Next. I'm going to talk about the first one, which was supported by WHO Afro, and we signed the MOU with WHO, and we with the WHO we established a scientific committee, and we selected the participants from 5 countries in Central Africa: Congo Brazzaville, Gabon, Centrafrique Republic, RDC, and Chad. And the participants were from the animal and human health sector and the environment. And the main objective of this training program was to train current and future laboratory leaders to acquire leadership skills, to build, strengthen, and manage national laboratory systems. Next. Specifically, it was to train 25 laboratory professionals in Central Africa, to prepare 10 to 15 experienced high-level laboratory professionals to serve as mentor for the participants, and to establish synergies and exchange to strengthen collaboration between national laboratory leaders in this One Health concept system. Next. Also to consolidate the Global Laboratory Leadership Program content, methodologies, and processes, and to create and maintain a virtual discussion and information sharing group for the participant, and last, to establish a mechanism to sustain the training outcomes. Next. Okay, now I'm going to talk about the organization. It was a 12-month program starting from May 22 to April 23. And it was in 2 in-person sessions and 1 online session, and the completion of the personal project by each participant. For the 2 in-person phases in May and September, we organized them in May and September for in-person session. But for the online, it was in June and July. And the personal project implementation monitoring phase took place from October to December. And in April 23, the final session was organized to present their work in front of a jury composed by some of our professors. Next. These are the picture of, on the right, you see the picture of all the participants, and you see on the left the representative of the WHO in Mali and the Secretary General of Ministry of Health of Mali at that time. Next. The first session was organized with 25 participants. We were expecting to have 25 participants, but 21 were able to travel to Bamako, and 2 were following the course online, and 11 facilitators were selected by the CECM based on their area of expertise to deliver the module in of the training. 4 WHO staff members, based in, 2 based in Lyon and 2 from Brazzaville, 1 from CECM, and 6 from the public and private institution in Mali. We give them 20 hours of course over 10 days working, 10 working days, and face-to-face and remote facilitation for those unable to travel. And didactic sessions were organized and alternating group activities and scenario-based exercises. A presentation of the quality approach at Rodolphe Murier were done because we are at that time the only laboratories accredited for ISO 15189. Next. And this is the training program. You see here, introduction to the Global Leadership Laboratory Program, introduction to laboratory system, laboratory management, financial management, human resources management, information system, general leadership, and laboratory policy and strategic planning, and organizational leadership. Next. And the participant and the facilitator were daily assessed. Daily module assessment was conducted at the end of each day by all participants through the identification in plenary session of the 3 weaknesses and 3 strengths of the training each day. And final module assessment by all participants was conducted at the end of the training using an individual paper questionnaire. And the final module assessment also by the facilitator was conducted after the training using an online questionnaire. Next. And at the end of the first session, participant knowledge were assessed before we did a pre-test, and at the end of the session, we did the post-test. Next. And this first session was followed by online session, and of the 25 expected participants, only 21 were able to participate online. 9 facilitators from Mali public and private institution, and 12 days of training divided in 2.5 hours for each session, twice a week, for a total of 27 hours were organized. And the virtual sessions were systematically recorded to allow those absent to access the audio of the course. And an alternation between didactic session and scenario-based group were organized, and the course materials were sent electronically to all the participants. Next. And we then organized, after this online session, a second session in person in Bamako from 12 September to 23. And with some of the participants, only I think 20 participants were able to travel to Bamako. And the session, this session concluded with a presentation of personal project in the presence of all the mentors in front of a 5 jury member chaired by one of our Professor Isaka Sagara of MRTC. And you see the training program was message and media relation, risk communication, scientific communication, overview of a model laboratory system, and infectious disease case study. Next. And then we organize, after this second session, we organized the final session in April 23. We invited 4 members of jury, and each of the participants presented the personal project, the result of the personal project, and then we give them 30 minutes to present the project, and then the jury give them some suggestion for improvement, and then the jury then proceed to score the result. And the result, overall result, all the participants were satisfied. Next. And the result, 19 participants received that certificate of completion. Only one among the 20 participants present at Bamako received only the certificate of participation because he was not able to present his project. And this training was really an example of success. Bringing leaders from Central Africa to West Africa to train them on global laboratory leadership program. Next. Then we organize another GLLP with Fondation Merieux, but this was really organized with Fondation Merieux, sponsored by WHO. It was a program for Mali, Guinea, and Chad, but CICM Mali implemented the project in collaboration with Fondation Merieux only for Malian leaders. And the activities were organized from May 26 to December 31 of December 23, and with 14 participants. We organized 4 training sessions held at CICM. Next. And during the project implementation, participants were assisted by 6 mentors, 4 of whom were from CICM, and the other one from IANPHI, where Professor Ibrahima Gindo is the director, and one were in Lavestock Research Laboratory, and one from MRTC. And the final session was organized to present the result of the project in front of a jury. And then at the end, we organized a certificate donation ceremony in November, 30th of November. Next. At the end, we did some assessment of the implementation. I show here only 4 examples of topic of the project the participants have presented. Assessment of implementation of national quality control in public laboratories in Sikasso, which is in a region. Improvement of bacteriology sample processing during shift at the medical biology analysis laboratory. And the last was improvement of diagnostic capabilities of the Central Veterinary Laboratory. These are the example of project participants have presented. The next one, please. Yes, at the end also we discussed with the participant on the future of the program, and here they listed some of the suggestions need to continue the training through GLLP program, particularly for the cohort that has just completed the missing module, because they were the program were only on 4 program of GLLP. And we also think about how to help participants to implement their projects. And they also raised the need to create a direction of laboratory system and how the laboratory leader can be involved in this direction of laboratory. Next. And here, this is the last slide showing the participant of the Mali with the second program with the mentors and the coordinator of the program. I think this is the end of my presentation. I thank you, and we'll take a question if you have it. Thank you very much.
Thank you so much, Professor Kuriba, for this very detailed presentation of the actual training program. I believe this will be helpful for countries that would want to implement such a program in laboratory leadership. So I will invite my co-moderator to introduce the next speaker. Alex Ario, please introduce the next speaker.
Thank you, Chinwe. Thank you for steering the process from the beginning. I do appreciate. So, colleagues, our next presenter is Professor Dr Hien. He's a physician and a public health researcher with advanced training in France, Benin, Belgium, and he's currently serving as a senior researcher in an institution, IRSS in Burkina Faso. He also worked as a Director General of the National Public Health Institute of Burkina Faso. He's my vice in the IANPHI Africa Network, and he has very strong leadership in public health, leading about 15 research projects, and has published many articles, over 180 of them. He's contributed to books, thematic reports, and his work spans health systems, health policies, epidemic management, and universal health coverage. His expertise includes infectious disease and non-communicable diseases, adolescent maternal health, chronic diseases, and quality of care. He's active in national and international scientific societies and journals. He also provides technical support to African countries in building national public health institutes and strengthening health security management. Professor Hien, the floor is yours.
Thank you, my vice. I would like to speak in French. Sorry for that. If you are agree, I can continue. Thank you for that.
Just Hervé, just let me explain to everyone that if you need English subtitle, you can go to the parameters of Zoom. You go on subtitles, and then you can choose to have the translation, the automatic translation in English.
Okay.
You can go ahead.
I can?
Yeah, please go ahead. Share your screen and start presenting. Thank you.
OK. Merci beaucoup pour l'opportunité que vous m'avez donnée de partager mon expérience sur le leadership des laboratoires. Effectivement, je suis spécialiste de la santé publique. Je travaille beaucoup avec les laboratoires, mais je ne suis pas biologiste. Je ne suis pas biologiste du tout, mais j'ai vu que dans tout mon parcours, le laboratoire a été quelque chose de très constructif dans la carrière de santé publique et même dans la santé des populations. Je vais pas utiliser de PowerPoint. Je vais prendre mes 10 minutes pour donner une expérience sur le cas du Burkina, de ce que j'ai vécu dans ce système de santé et ce que je vais délivrer de spécial. Comment actuellement, pour ceux qui sont en train de faire des réformes des systèmes de santé par la création des instituts nationaux de santé publique, ont pu créer le lien entre les laboratoires de routine et les laboratoires nationaux de référence. Ce n'est pas une question qui est facile à répondre. Je sais qu'il y a des pays qui ont eu des difficultés, comme le nôtre, mais je sais que au finish, le système de santé n'avait pas le choix que de faire des compromis pour que ces deux systèmes de laboratoire travaillent ensemble dans le cadre de la sécurité sanitaire. Beaucoup de gens, effectivement, ne savent pas comment ces deux systèmes collaborent ensemble. Beaucoup de gens ne savent pas comment est-ce que, quels sont les compromis que ces deux systèmes ont été, quels sont les compromis qui ont été faits pour que les deux systèmes travaillent ensemble. Je veux dire le système de laboratoire de routine qui se trouve au niveau du premier contact avec les personnels, les patients dans les districts sanitaires et même les laboratoires qui se trouvent au niveau des CHU. Ça, c'est le système de laboratoire de routine. Et maintenant, le système de laboratoire de référence et les labos nationaux de référence où nous faisons les diagnostics de référence, comme la tuberculose, le VIH, la fièvre jaune, ainsi de suite, ainsi de suite. Alors, le cadre conceptuel de la création des instituts nationaux de santé publique et même de l'organisation de la sécurité sanitaire dit quoi? Pour faire cette réforme et faire face à la sécurité sanitaire, on conseille au pays de mettre en place au minimum 4 fonctions. La première fonction, c'est celle de la réponse face aux épidémies et ce sont les COUPS, les IOC, les CORUS qui gèrent cette fonction. La deuxième fonction, c'est celle de la formation. La troisième fonction, c'est celle de la recherche. Et la quatrième fonction, c'est celle du laboratoire. Depuis une dizaine d'années, quand les pays ont commencé à transformer les systèmes de santé en implémentant ces fonctions, il y a eu du bruit, il y a eu des résistances, il y a eu effectivement des doutes dans ces fonctions au niveau donc des pays, dans les laboratoires de routine et les laboratoires nationaux de référence, parce que la communication, la sensibilisation, la gestion du changement et le leadership des laboratoires n'avaient pas été plutôt au niveau pour expliquer correctement aux gens. Alors, qu'est-ce qui s'est passé? Les laboratoires de routine sont, comme je l'ai dit, dans les hôpitaux. Et les laboratoires nationaux de santé, les laboratoires de référence sont au niveau donc étaient aussi dans le système de santé avant la création des instituts nationaux de santé publique où dans certains instituts nationaux de santé publique, on a demandé à ce que le laboratoire soit coordonné par les INSP, les labos nationaux de santé publique. Le cas du Burkina, où nous avons créé ce qu'on appelle le laboratoire central de référence, dans lequel ce laboratoire coordonne tous les 8 ou 9 laboratoires de référence et y compris aussi une biobanque dans lesquelles nous faisons l'animation et l'archivage des germes, ainsi de suite, ainsi de suite. Alors, dès que ce système est venu, il y a eu effectivement, comme je vous ai dit, des contradictions. Parce que la direction qui est en charge des laboratoires de routine se trouve au ministère de la Santé, qui s'appelle la direction des laboratoires de biologie médicale, et le laboratoire central de référence, qui est aussi une direction qui est chargée de coordonner les laboratoires nationaux de référence, a aussi une direction au sein de l'Institut national de santé publique. Comment ces deux systèmes doivent collaborer ensemble pour travailler, faire le diagnostic de routine, envoyer les échantillons dans le laboratoire national de santé publique, faire le diagnostic rapide pour que le chorus et tout le système se mettent en place pour la gestion des épidémies selon donc, le système de gestion selon l'incident. Ça n'a pas été facile. On a dû mettre en place un comité de pilotage, un comité composé de tous les professeurs de santé publique et de laboratoires d'immunologie du secteur public et privé pour développer un consensus et des compromis sur ce que le laboratoire de biologie clinique au niveau de la routine doit pouvoir continuer à faire et sur ce que le laboratoire central de référence qui coordonne actuellement les laboratoires nationaux de référence doivent pouvoir faire. Je rappelle que avant la création de l'INSP, par exemple, le laboratoire mobile P3 que nous avons, par exemple, le laboratoire qui s'occupe donc de la résistance antimicrobienne, les laboratoires qui s'occupent de l'identification et de la surveillance du VIH et de la tuberculose étaient effectivement des laboratoires qui étaient compris aussi dans les gestions de routine. Donc, ce travail a été fait et actuellement, et comme le laboratoire de centrale de référence a une sous-mission de développer le One Health, c'était important que ces deux systèmes puissent travailler ensemble de telle sorte à ce que le diagnostic, la surveillance basée sur les événements, sur les indicateurs identifiés par donc les laboratoires au niveau du premier niveau de système de santé, soit transférés au niveau des laboratoires nationaux de référence et le diagnostic de référence se faisait là. Donc, c'est une histoire que je raconte parce que actuellement, le système travaille assez bien et les deux systèmes cohabitent ensemble et profitent des systèmes de formation que le laboratoire central de référence organise, aussi bien pour le personnel de routine qui se trouve au niveau des soins de santé primaire. Et aussi, ces laboratoires de routine profitent aussi de l'expérience de la qualité des soins et qui a été développé au niveau de ces labos nationaux de référence au sein de l'Institut national de santé publique au profit effectivement du diagnostic des maladies des populations. Alors, si je dois faire une recommandation, et si je dois repenser un peu le cadre conceptuel de comment il faut mettre en place les fonctions essentielles pour pouvoir développer le système de santé, pour qu'il puisse répondre face à la sécurité sanitaire, je mettrai le laboratoire au centre et au centre duquel il collabore maintenant avec le COUPS, les IEC, les IOC, il collabore avec le système de formation offerte au niveau national, il collabore avec la recherche et il collabore avec l'expertise méthodologique. Voilà à peu près cette expérience que je voulais partager avec vous, parce qu'il y en a qui ont besoin de ça pour s'exprimer, pour que ces deux systèmes puissent travailler ensemble. et ne puissent pas être en compétition. Merci beaucoup en tout cas pour la parole que vous m'avez donnée. Et je remercie au passage tous les collaborateurs de l'Institut national de santé publique du Burkina et notamment le professeur Isidore Bonkoungou, avec lequel nous avons consolidé cette idée que je partage avec vous. Merci beaucoup.
Thank you. Thank you so much, Professor Hien. That was wonderful presentation. And ladies and gentlemen, I do believe that we've come to the end of the presentations of today. We've had 4 good presentations from Samuel Gidudu, from Borema Koriba, Ibrahima Guido, and of course have Hien, which has just ended now. So our next session now is questions, remarks, comments. So we shall do it in 2 ways. One is if you posted it through the chat, I believe, Sarah, you've been compiling them. You'll go through them one by one. But also for those who may not have written in the chat, please raise your hand and then we shall pick you and then you give us your question or whatever comments you would like to give. So we could start with the chat questions and then as we look for any hands that come up. Sarah?
Yes, so the first question in the chat from Asif, is there a plan to sustain and carry forward the lab leadership program for upcoming workers? I don't know for who this question was intended, but if any of the speakers wish to answer, they are free to do so.
Yes, I believe any of the speakers can address it.
Yeah, sure.
What's your plan for sustainability of the training program? Perhaps we'll start with, we can start
with Samuel?
Yeah.
Thank you very much.
Okay.
Yes, our plan apparently is to have the program embedded in the government structures. And I must report that this is in the evening of implementation, and we are hopeful that in the nearby future, it will be embedded in the national systems. Currently, it's fully funded by US CDC. Thank you.
Yeah, very important that this is integrated within the national framework so that it's sustained. Koriba, is that your experience as well?
Yes, yes. We have some discussion. After our training session, we went last year to Togo because WHO wanna think about the sustainability, and one of the I think it's better, as he said, Samuel said, it's better to integrate in the national, training program. And we are thinking here to, embed this GLLP program in the training of the health leaders in Mali, first in the Master of Biology, and also in the program of the basic program of pharmacists and medical doctors at the Faculty of Medicine and Faculty of Pharmacy.
Very important point there, Professor Koriba. I was about asking whether there is any long-term plan to integrate that within the training curriculum of, the routine training curriculum for laboratory scientists and other health workers. So that's interesting. Professor Guindo?
Okay, thank you very much. Just a quick comment to add. I think it is very, very important, global leadership program for laboratory. And this program transforms the responsible of laboratories. And we think about who is the tomorrow lab responsible. And according to this thinking, we think that it is important for the lab planification, we have one of two kind of lab coordination in the country according to the specificity of each country. Each of the coordinating laboratory group have to take into account the leadership program, because without leadership, we have no laboratory system. We just run to show a routine lab activities. The leadership transform the lab responsible, and they will be able to react for each case in case of emergency and in case of lab assessment or anything regarding laboratory. It is very important to take into account the planification of the leadership global lab leadership program in the laboratory planification, public health laboratory, and also biomedical laboratory in town. That is my comment that can help us to continue sustainable for leadership laboratory in Africa. Over to you.
Thank you so much. Dr. Hien, do you have any response on sustainability for your own program?
For me?
Yeah.
Yes, I will speak in French again.
Please go ahead.
Yes. Ce que je viens de dire est très important en termes de pérennisation des actions de lutte contre les épidémies et la pérennisation des actions surtout pour renforcer la soutenabilité de la gouvernance au niveau des laboratoires et de la gouvernance même de la réponse face aux épidémies. Quand on ne maîtrise pas les deux systèmes de laboratoire dont je viens de parler, qui doivent obligatoirement travailler ensemble dans un même pays et avec les autres pays, nous sommes dans une situation où on va toujours travailler en silo. Pourtant, tous les réseaux qu'on est en train de mettre en place, c'est pour que les gens puissent en profiter, que l'expertise des laboratoires puisse en profiter. Et je pense que l'expertise des laboratoires actuellement, en termes de leadership, peut jouer un grand rôle dans la continuité, dans la pérennisation de toutes les leçons apprises qu'on a dans le cadre donc, de la lutte contre donc, les épidémies et les flambées. Et moi, je pense que ce que je viens de dire sur les sous-systèmes, il y a beaucoup de gens qui en souffrent. Hein. Les labos de routine qui sont dans les différents pays et les laboratoires nationaux de référence qui ne collaborent pas ensemble, alors que c'est pourquoi, en fait, beaucoup de choses dans le One Health ne bougent pas. C'est pourquoi beaucoup de choses dans le diagnostic précoce dans nos différents pays ne bougent pas. Et donc, je suis confiant qu'avec les différents réseaux qui ont été annoncés ici, et avec ce que je viens de dire sur la collaboration nécessaire à tisser entre l'ensemble des réseaux de laboratoires dans un même pays et à l'intérieur du même espace, ça peut nous aider beaucoup à aller de l'avant dans la gestion de la sécurité sanitaire. Merci encore.
Thank you. Thank you very much. So I have a couple of questions, but I will ask two, and just one person will address one of the questions, whichever one is relevant to you. And then Alex will now take us through the next set of questions in the chat, and for those that are raising their hand. So the two questions I want to ask, number one, what has been your experience, the experience of leadership for cross-border laboratory collaboration during epidemics, to prevent cross-border or to detect early detection of cross-border epidemics? Anyone can address that. Then my second question is, what indicators do you use or have you identified that will help you to assess the impact of this training program on long-term in the laboratory capacity for your country? So whichever question you want to address, please go ahead. Just one person per question.
Okay. Can I speak?
Yes,
from
please.
my side? I think I can share my experience for the cross-border laboratory collaboration outbreak. We have, in the context of at that time, Mali, Burkina Faso, Mauritania, Niger, and Chad. They were together on the concept of what they call G5 Sahel. That was a program to come together to fight against, the insecurity in the G5 Sahel program. And beside this program, we laboratory leaders in Mali, Burkina Faso, it was CCM, Centre Miraz from Burkina Faso, the Sermes from Niger, INRSP from Nouakchott, Mauritania, and the National Laboratory from Chad. We came together to, build a network on biosecurity and biosafety to tackle all the program, all the problem of viral outbreak, or using, at that time, you see in this in the Sahel region, we are thinking that if these terrorists use, the biological weapon, also we are thinking to have the capacity, to respond. And we established since, I think, 2017, a network between these three countries. And we also developed the concept of mobile lab. Each country under this program, supported by German cooperation, and the Institute of Microbiology of Bundeswehr, which is German army based on in Munich, we established the concept of mobile lab. And each country, has his own mobile lab, and then we have one network mobile lab based at CSM here. And we did a lot of training of our technician, and we built what they call the intervention, team, and also each year we organize, and what they call deployment, of the laboratory in one of the country. We have deployed this mobile lab in Mali, then in Burkina Faso, in Mauritania, and the last was last year in Jamena. And the program actually ended, but we have the capacity and we have regular meeting in order to think about, these viral diseases. That is my experience,
Excellent. I really appreciate that you're sharing this, because I needed to push this question in. Cross-border collaboration is key for us, especially with the committee of PPRR. Cross-border collaboration for health security is important to strengthen both national, regional, and global health security. Thank you so much, Professor Koriba. Professor Guindo, you want to address the other question?
Yeah, allow me please to a quick thing to add for cross-border collaboration. Just a quick thing.
Yeah,
I think we have to consider laboratory as a component, and the lab component is not alone. in the system. It is a health system, surveillance system, and many other components is part of the system. We have surveillance, immunization, EOC, and so on. If something occurs, for example, in a cross-border area, it can be a land point of entry or other area in cross-border. If a lab arrives to detect, because point of entry is also a pack of activities, including screening and, if possible, lab rapid test detection. And according to the availability of rapid tests and so on, or screening, according to clinical sign and so on, the point of entry can perform a test or refer sample to another reference laboratory to test. And in case of positive case, the other component of the system start also a next collaboration activities. It can be immunization. For example, if it is a yellow fever case, for example, cross-border Ivory Coast and Mali, we put in place a response by immunization, the village or population living across the two borders.
Yeah.
And also the surveillance team work together to define the contact case across the border and to take samples sent to laboratory and continuous testing. Then we have to understand that the cross-border activities, it's not only a lab responsibility, but also a responsibility of other components in the surveillance system, such as surveillance, immunization, EOC, and so on.
Yeah.
That is the comment I would like to add.
Thank you so much. Thank you so much. Very valid points there and very helpful. So we'll pack my second question while I hand over to Alex to take the other question from the chat and perhaps close us.
Yeah, thank you, Chinwe. Sarah, do we still have any burning questions on the chat?
Yes, we had a question from Dr. Muhammad Akhtar, but I think it was specifically for Prof. Burima about the mechanism of transportation of samples. Like, what is this mechanism?
Okay, that is Prof. Burima, right?
Yeah, I think so. I think it was during Prof. Burima presentation.
Prof. Burima, any comments on transportation of samples?
Yes. No, during the GLLP program, we ask all the participants to think about a project, based on their need in where they are working. And some of the participants, I think one participant presented, on a project how to improve, the collection of the samples, But and he worked on how to improve the transportation of the samples, and he proposed, some of the solution to tackle the problem of transportation of samples when something happened, when an incident case happens somewhere, how in his setting he can improve the transportation of samples to the laboratory. That is the response I have.
Okay, that's good. Thanks, Professor Burima. Yeah, I know Annette also was saying she's new to the program. Annette, is true. GLLP actually has been there quite a while, but we shall share the slides, so you learn more from the slides, but also you can reach out reach out to any of the presenters. We'll give you a little bit more about what the laboratory leadership program based on the GLLP model is like. I think those are the major things from the chat. Time is not our best ally. I think we have Virginia, one hand, Virginia, and then maybe we wrap up. Virginia.
Yes, thank you to give me the floor. Can you hear me?
Yes, we can hear you loud and clear.
Thank you very much. So, hello everyone. My name is Virginie Dolmazon and I work in WHO. And I don't have a question per se, it's more a comment. First, thank you very much to all the speakers. I know some of you, and I'm very happy that the GLLP can be presented in such forums. So thank you to IANPHI Secretariat for that. I work in WHO, but I also work for the GLLP Secretariat at global level. So in that capacity, I just wanted to echo everything that was said, specifically around sustainability. I think the more important here is really to have this program owned. So ownership of the countries. There is no one GLLP. There are as many GLLP as there are countries implementing their GLLP. And that the only way the program can be sustainable or can become over time sustainable. And also this is a program. So this is not a one-off training. This is more a learning journey, because the lab leadership of a country will not change with one cohort or with 1 year, but it will take a few iterations and 1 or 2 generations even to get things, let's say, change and evolve little by little. So that's why it cannot be a one-off. It has to be built over time, this generation of future leaders. So that's a comment. And again, a big thank you to all of you. In case of any question, comment, suggestion for improvement, some of you know me, but the other, you can always reach the GLLP Secretariat. There is a generic email address that is gllp@who.int. Thank you again. Over to you.
Thank you so much, Virginia. I think that sorts out many of the issues that people were asking. And so members, please reach out to Virginia and get a little bit more information on GLLP. No, we have only, I think, a few comments in the chat. Samuel is saying LLP in Uganda is strengthening cross-border collaboration through providing technical support to other countries. This is being done through Regional Integrated Laboratory System Strengthening Project. Yeah, and then, I think we are running out of time. I want to say thank you. Thank you, everyone. Thank you, all our presenters. This has been wonderful. I know time has been short. 4 presentations within 1.5 hours is not easy, but I think we've managed quite well. So I want to thank you so much for really turning up and listening to all these great presenters. The presenters, thank you. You've done a wonderful job. I want to thank my colleague Chinwe, who actually took on the mantle in my little absence from the beginning. It was great. Chinwe is wonderful. Thank you so much for doing that great work. And Sarah, thank you, and the whole IANPHI Secretariat for all the great work you've done to ensure that we have all these webinars organized by IANPHI Africa Network. And this has been actually unique. Chinwe must have told you from the beginning that this was a combined webinar. It was not only IANPHI Africa Network. So I wouldn't want to repeat it. I know Chinwe must have told you. So thank you, everyone. And I wish you a wonderful evening, morning, wherever you are. See you next time. Bye-bye.
Thank you very much.
Thank you very much.
Thank you, everyone.
It was a
Bye.
pleasure. Yeah.
Bye.